Okay, this video is about insights from tutoring medical students. I sometimes tutor medical students. I have friends that have kids that are in med school, and they ask me to talk to their kid. Sometimes I have medical students follow me around. And so anyways, it's kind of a little bit interesting, the sort of conversations that come out of it. If you're interested in education or medical students, you might find this interesting. So medical student, first of all, this one medical student was a little annoyed with me because I'm talking about a lot of physiology, pathophysiology to understand how things work, but I'm not going by their book. And the student says to me, why are you teaching me this stuff? This stuff that you talk about is not in my textbook. I'm not going to get tested on it. Why should I learn this? And I would say, because it's the true explanation of what causes atherosclerosis, for example, or any other system that we're talking about. A couple of days later, the student will come back, and I'll often tell them, read this book or watch this video on the internet, and then we'll have a conversation about it. And because in a sense, it's like the Oxford tutor program, whereby the students to go out and research and study a subject, then come back and discuss it with the professor. That's a challenging way, something that they're interested in, but they still have to go out and acquire the knowledge and then be able to discuss it. And also the student will say to me, he goes, why do you always want me to talk? And I said, because when you talk about a subject, that's part of learning the subject, being able to articulate it, the nuance of the subject. I say, you guys are trained on these multiple choice tests. Real life is not a multiple choice test. In real life, you have to talk to patients. You have to talk to other doctors. Patients will come up to me and say, what's going on? What do you think is going on with this patient? Can you help us out? I have to read the chart, listen to what they have to say. I have to look at the films, the CT scans, the MRIs, the plain films, the ultrasounds, and I have to put it all together with their labs. Okay, I have to then articulate what's going on. You want to be able to talk about whatever you're studying. The A+ students can articulate what's going on in a subject, okay? And if you want to improve your academic performance, that's one of the things you should do. I can remember that all the way back from my undergraduate days. Like when I was in biology, I hung around with guys who were A+ students, and we would have conversations about evolutionary biology, ecology, biochemistry. Okay, so the student then says to me a few days later, after having gone over the material that I recommended, I saw the video, I read the paper, it made sense. It was like a story. And I said, yes, whenever possible, I try to understand physiology, pathophysiology as a story, like with pictures. And it's a lot easier to memorize something when you see it as a chronological story and you have key pictures in it that sort of summarize a lot of things. Students like, yeah. And I said, whenever possible also, I try to ask why. Why does something happen? For example, why does the immune system do this? Why is there an innate system of immunity and an adaptive system? Okay? Because when you understand why something happens, then you can sort of deduce the rest from a few key points. You have a much stronger form of knowledge. My job as a doctor, and I'm really a pretty highly specialized doctor, and I have people come to me from all over the place to solve complex medical problems, is I have to have a good ability to picture what's happening in different organ systems of the body and with different disease conditions, okay? So I have to understand it. Why does the immune system react this way? What improves blood flow, okay? I could care less what's on a test or in the baby books that are given to medical students, okay? So student says to me, he goes, I wish all medical school was taught this way. How come they usually just give us a list of stuff, list after list of stuff to memorize, but they never put it all together for any topic? It's sort of taught to us as disconnected, as a bunch of diseases that have nothing to do with each other. And I said, well, that's partly because they don't know how to put it together themselves, okay? Usually these professors are very specialized. They only know a narrow little field. It's partly because also a lot of times the worst professors are the ones that are sent to teach the medical students, like as a punishment. The really best ones are off doing research. The ones that no longer can do productive research, go teach the medical students or we'll fire you, okay? It's also partly because the very few people who actually do know a lot and are able to put it together, they're never allowed to write medical textbook at the big publishing companies. This stuff does not get in the book. It never gets in the books. Okay, there's a couple reasons for that, but the big one is they don't want the students to learn it. Okay, it's also partly because a lot of times textbooks are actually written by fellows. The senior attending who's famous in their specialty doesn't want to write the textbook because it doesn't get them promoted, so they just tell their fellow to write it, and their fellow doesn't really know much, so they just copy the old version of the textbook. Okay. And so students are like, well, gee, that's crazy. Me, yeah, and it's worse than that. I'm banned from teaching, let's say, speaking to the students at my old medical school. I'm Hispanic. My mother's off the boat Puerto Rican. I'm part Hispanic. Of course, I'm American. I'm Irish. My father was Irish. My mother was Puerto Rican. So, for example, the Hispanic Student Center for Excellence, they have a lot of students that are not doing well in school. And I said, look, I'll give them lectures on study skills or a few topics, how to memorize biochemistry cycles, things like that. No big deal. I'll do it for free. Because I was happy to help them. I didn't mind it. I still had some friends over there in other departments. It would be fun to go visit. And the Hispanic Center for Excellence would not even consider having me lecture. And I know why. First of all, I'm probably the smartest Hispanic doctor in the whole world. I graduated first in my class, 333 students, 99% board scores, okay? And first of all, because they don't really care about the students. What they want is more funding. And the more they can say, oh, our students aren't doing well, it's because of racism and all this other BS, then they can get more money. Okay, if I come in there and I teach them good study skills and their academic performance starts going up and becomes the same as everybody else, then what are they going to say? They can't say they need more funding anymore. So they're not really a Hispanic Center for Excellence. They want them to do poorly so they can keep on saying they need more funding, okay? That's one of the reasons. The other reason is there's a weird little jealousy. If you notice, there's a lot of it's hard to explain, but there is jealousy. And so they'll bring in guys who barely graduated, with the worst academic performance possible to still graduate, to teach the younger students. But then somebody like me who crushed everything academically, they're jealous of me. They don't want it. It's almost like I'll shine a brighter light than they've got. And they don't like that. They really don't. It's weird, but it's true. So then the medical student says, well, why don't you just lecture at the other local medical school? I said, oh, no, I'm banned from that place too. They go, how could you be banned from talking at a medical school? And I got banned at the other medical school because I made a joke in my book. And then one of the professors at their university complained about the joke in my book. I was writing about leaky gut and autoimmune disease with regard to fecal transplants. With leaky gut, in some of the conventional medical journals, they'll talk about doing a fecal transplant where, let's say, a woman who's married, her husband's feces will be put into a slurry with water, and then they'll inject it into her rectum, into her colon with a colonoscope, and that's called a fecal transplant to give her better gut bacteria, the ultimate biotic, whatever, supplement for gut bacteria. Of course, they're too stupid to just tell her to eat more fiber in her food. But anyways, I said a joke that, well, if a wife, is being considered for a fecal transplant, why doesn't she just kiss her husband's ass and take a little shit from him? It was just a joke, okay? Oh, then the professor at the school says, oh, that's misogynist and patriarchal. I'm like, you're an idiot. It was just a joke, okay? And of course, the real reason is I make fun of her specially because I know that a lot of stuff they do as a standard of care doesn't really work. And so I pointed out, look, it's proven it doesn't work. Okay, so they're afraid I'll tell the students the truth about their specialty not working. And I don't want, if I go over to the university to lecture, I'm not going to insult people. I'm not going to make fun of the different fields too much. On my YouTube channel, I'll say whatever I think, but I'm not going to do that when I go give a visiting guest lecture. But I do think it's kind of funny, but it's not a joke. The system is designed to make sure that the students never learn the truth about how the body really works and what causes diseases. I can tell you, all the medical textbooks are, I didn't say this to the student, I'm just telling you now with my lecture here, because I want to keep the student enthusiastic and encouraged. I don't want to even tell them how much of a joke their textbooks are. But anyways, that was kind of funny. So the student comes back a couple of days later after doing some assigned reading and watching some videos, and he says, I now think I understand how you think. You're just trying to understand the human body, how it works in health and disease. You don't care about taking a test. And trying to get this thing to go here. And you combine information from wherever you get it. You don't just take information only from the book. I go, yeah, I have to do that because the book will never put it together. Medical books never put stuff together. I go, if you want to see the big picture, you have to take information from a wide variety of sources. And my goal is not to take a test. My goal is to solve complex medical problems. And I'm pretty well known for that. Docs come to me from all kinds of locations to ask me how to solve complex problems, okay? I'm the doctor that teaches other doctors in neurology, neuroradiology, and in a lot of fields. And I would also say to the student, I tell them, look, once you understand these big categories of disease and how the systems work overall, why the immune system behaves like it does, and how these other systems work. What's the goal of the kidney to excrete nitrogen, to balance acid base, etc. Then you can make sense out of all the little details about the individual ion pumps or whatever is being talked about. You'll become a better student by learning the big picture from me. And then for your own individual school, you'll have to fill in all the details that they have you memorize. And the student says, yes, you are connecting things. It's more fun to learn this way. It makes me feel like I'm learning how to help people instead of just memorizing stuff for an endless series of tests. I mean, yeah. So anyways, that's how it works. And I actually think my approach to understanding the big picture of physiology, pathophysiology, biochemistry makes it so much easier to later on memorize all the details. I've been playing this game for a long time. I've been a doctor over 30 years. I know what's true and what's not true in medicine and how to memorize very big, complex amounts of information. So anyways, for what that's worth, I think any medical student would benefit from watching my lectures. What causes atherosclerosis, how do you improve blood flow, how do you heal things, what's going on with the kidney, what's going on with the brain, what's going on with the heart, what's going on with the ion pumps, what's going on with the calcium mechanisms, all this stuff. It's an advanced version of the physiology in your own books, but mine puts it all together so it'll make sense and you'll remember it forever. And then when you have to learn all these details at your school, you'll be better prepared to do so. So anyways, for what that's worth.